Good afternoon. My name is Christy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Christy, and good afternoon, everyone. There are 5 cases of COVID-19 in the Central Zone. 2 of them are school-based cases we announced yesterday, and 3 are close contacts to previously announced cases. Dr. Strang is going to have more details in a moment. The cases in our schools are students who are isolating. I understand today a number of students stayed away from our school, as well as a number of teachers. I understand this is very stressful, and I get that you are scared. This is the first time COVID has entered our schools. I want to reassure teachers, students, and most definitely students and parents, we have a plan in place to do our best to protect you. Public Health has issued a notice to anyone who could have come in contact with these students. Those contacts are now isolating for the next 14 days. And if required, testing will be made available. The classrooms have been shut down and the cleaning protocols that already exist are underway. Our department has been working with those schools to ensure an overnight crew does an even deeper dive to sanitize the school. This is a wake-up call. COVID is not just entering 2 of our schools. It's quickly creeping into a number of our neighborhoods, particularly here in the Central Zone. And as Dr. Strang will discuss, Public Health is having trouble tracing a number of those cases. This is very concerning, and it tells me that we are not taking COVID seriously. And Dr. Strang will give you some examples of why we feel that way. Dr. Strang.
Thank you, Premier. Good afternoon, everybody. I've got a fair bit to cover today, so bear with me. I'm going to give an overview of the new cases and case numbers and talk about the school cases, and then update you on the overall picture and the potential roads ahead. We were last in front of you on Friday, November 13th, and since then we've announced 15 new cases of COVID-19, including the 5 that we're announcing today. As of today, we have 24 active cases of COVID-19, and we're changing things up a bit. I'm not going to give you the cumulative numbers because they're all mostly they're wave 1 and they're kind of irrelevant now. But when you look at the picture, in September we had 3 new cases. In October we had 21 new cases, and so far in November we've had 42. That's a trajectory we can't continue to follow. All those cumulative numbers that they will be up on our website, but as I said, they're all wave 1 and not really meaningful right now. Yesterday, Nova Scotia Health Authority's lab completed 966 tests. And we're seeing the separate clusters that we've been talking about becoming linked together primarily through social activities. So let me talk about schools in more detail first. Yesterday, we announced 1 case at each of 2 schools, Auburn High in Cole Harbour and Graham Clayton Junior High in Cherry Brook. The 2 people involved are self-isolating. Everyone in each class and bus that included these 2 people, as well as a small number of close contacts during recess and lunch, has been asked to self-isolate for 14 days, and they're in the process of starting to arrange testing for them as of today. There was communication directly to all of the individuals and the affected families who were identified as close contacts. That was all happened by yesterday evening, as well as there was general communication to the broader school community, so they were all aware of the situation, the broader school community for these 2 schools, so they were well aware. And all that communication happened yesterday evening. I know that this creates a lot of concern for people about cases in our schools and the possibilities around that. But for us, this is not unexpected. It's not a surprise. Public Health and the Department of Education and Early Childhood Development have been working since the summer for this possibility, and we followed well-established protocols and communication plans as soon as we became aware of these cases yesterday, and that we'll continue to follow those established protocols in the days to come, if and when we get with these schools and with any other schools that may occur. When we have cases like this, like all other cases, public health investigates and determines who might be a close contact. And as I said, that we reached out and connected directly with individuals and their families, and that was all done by yesterday evening. For any of the people who are directly linked to those schools, if they're listening, if you have not heard directly from public health, it means you have not been identified as a close contact, and you can continue to go to school. You continue to go about your community activities as usual. It's only members of the school community who we have identified as close contacts, as I said, through classrooms or buses that are asked or they're required to stay home for the next 14 days. And we are continuing to support those individuals, those families, providing specific guidance for them. But we're also asking for the general community that there's no need to take further action, like canceling sport activities, or worse, excluding people from those two schools in community sport activities, which I'm hearing is happening. There's no increased risk for these individuals, and so we're asking if there's a need for broader community actions, public health will communicate that. But we're asking community groups to not take on their own action and further and take unnecessary action and stopping anybody who attends either of these schools from being able to participate in a range of activities. I'm also unfortunately hearing lots of things today about speculation, about rumors, about even things that are really stigmatizing towards the people the families that are involved, of these individuals. That is wrong and it's inappropriate. We need to treat people with kindness and compassion. There's a lot of fear and anxiety around this, and we don't need community piling in with unsubstantiated rumors. I've had several come my way when I've checked with local public health. There's no basis at all in fact in what the community is speculating about. So please, we need to be kind and careful how we treat each other and don't add to people's fear and anxiety. We fully expected to see cases in some of our schools. We were ready for that. But I think we have to, I'll come back to what I've said previously here, that the way we keep our schools safe is by keeping our general community safe. And that's where I'm going to go next. Last week I said Nova Scotia is at a tipping point. This week, and certainly when I woke up this morning, I was thinking it was starting to feel like we're actually on a roller coaster. There are many different paths that we can take on the roller coaster. Some are going to be more gentle than others, depending on what choices we collectively make. We are starting to see community spread. Travel is not just the primary cause of all of the cases in the province now. We have had 7 cases where we have not been able to clearly identify a source that is directly related to travel, and therefore we have to conclude that this may be from local transmission. This is very concerning and an important turn of events for us here in Nova Scotia. So we have to move beyond talking about just about travel and about individual clusters, and we have to focus on how we can keep ourselves collectively as safe as possible in the coming weeks ahead. Other jurisdictions were where we were at not so long ago, and they now have widespread with substantive pressures on their healthcare system and are needing to impose broad and tight restrictions. We don't want to have that here. We don't want to return to the days of a full lockdown. And I firmly believe we are still at a point where we can control the COVID path that we follow, but it depends on what we all do together. There isn't any one solution, but there are 960,000 Nova Scotians, so we have 960,000 solutions that rest with each and every one of us. We can slow and minimize the transmission of COVID-19 if each and every one of us takes on the role of being a COVID guard. And I use the word guard deliberately because this is a fight we're in. We need each of us to be on guard for each other and for our communities. So first and foremost, we need to return to being more careful about following our public health measures. And I'm going to go through the list again. You may be tired of it, but you need to hear it again. We need to have frequent and thorough hand washing. We need everybody who can wear a mask to wear a mask in indoor public places. Stop making excuses because you don't feel like wearing a mask. There are some people who cannot wear a mask for medical reasons, but those are very few and far between. So don't make excuses just because you don't feel like wearing a mask. The science now clearly shows that it protects others around us by us wearing a mask. Make sure that the mask is effective and you're wearing it properly. That means fully covering your nose and mouth, and using either a 2-layered or a 3-layered mask, not a face shield, not just a scarf or a thin gaiter that's pulled up from around the neck. You need a proper non-medical mask, and wearing it properly over your mouth and nose. I saw a funny meme the other day that said, scientific discovery, the back of your nose is actually connected to your throat. So, surprise. So if your mask is not over your nose, it's not doing the job properly. We need to maintain physical distance by staying 2 meters or 6 feet apart from others wherever possible, and even while wearing a mask while you're doing that. We need to be very clear and closely follow the gathering limits. No more than 10 people in our household or close social circle. And we need to keep those social groups as consistent as possible. Ideally, we have one group of 10. I know that's not possible for everybody, but we don't need 10 groups of 10. Minimize your social groups. Keep it to as consistent as possible. Keep it to no more than 10 at any given time. I know that we've gotten lax around this area, and lots of people are gathering in ways that are not following the gathering limits. It's natural. We've let our guard down as we got through the summer and COVID was low, but we need to up our game. It's now we need to pay close attention to our social activities and our social connects. If you feel unwell, it's really important that you need to stay home from work or school or any other activities and do the online self-assessment, or if you don't have online ability, go, calling 811, and then they'll take you through a process, and if you do need to have a test, you can get an appointment to do that. Even if you only have one symptom, because we're doing screening based on 2 or more symptoms in general. If you only have one mild symptom, we would ask that you stay home for 24 hours and see how that evolves. Because if you have COVID, it's likely going to progress and add another symptom. If you don't, then maybe your one symptom goes away quickly. So even erring on the side of caution. If you're unwell, stay home until you really have a better understanding of what's going on, watching yourself or doing the self-assessment. And I know that there are challenges for people, some people being able to be off work for lots of other reasons. We're looking for ways to support individuals are in those areas, but it's really important that people, if they're not well, they go home or they stay home. I'm also appealing to workplaces, to employers, that we're hearing some stories that our employers are saying that people need to come to work even though they're unwell. That's not helpful, and that's not being part of rowing in the same direction and keeping ourselves COVID safe. So employers, we are asking you to be tolerant and support your employees who call in or may get sick at work and say, I need to go home. We need to understand that they're following good public health direction, and we need you to support them to do that. This is also not the time to take trips out of the Atlantic bubble unless it's absolutely necessary. Stay home and enjoy what Nova Scotia has to offer. If you do need to leave the bubble, you need to remember you're going to have to self-isolate when you return to Nova Scotia, and you're going to have to be diligent around that self-isolation. Likewise, don't invite people from outside of the bubble to be guests in your homes, except if you have no choice if they come. And if they do come, you have to understand the requirements for the household is going to have to isolate as well. I know that we've been dealing with a pandemic for 9 months, that we have become complacent and people are tired, that this is also making people anxious. All that's understandable, it's normal, but we have to step up. There are many challenges in front of us. All the measures that I've identified, that they are simple in nature, but if we don't pay attention to them every day, they can become difficult to practice. They do require us to make some sacrifices. But I firmly believe that, we're well known in Nova Scotia that we will come together in a time of a crisis and support each other. Now is that time. We need to take this seriously and stand up against COVID-19. If we look across the country, we can see what can happen if we don't take this seriously. I want to appeal especially to young people. The current outbreak is really focused in the people who are in age 18 to 35. It's a group that is is mobile and very social. That's understandable. This has not been a typical year, and I know people are just trying to find a way to have some normal social life. But I'm going to appeal to young people directly that you are important to Nova Scotia. You are our future, and we need you now to be leaders in taking a stand against COVID-19. 1 year, 5 years, 20 years from now, I want you to be able to look back at the pandemic and say that you contributed, that you got it right and you did your part, that you were actually willing to give something up in being a COVID guard. It may not seem that COVID is a big deal to you. You maybe feel you're not vulnerable, that you're a healthy young person, but you don't know who is in your social circle. Who in your social circle maybe has an underlying health condition that you don't know about, or maybe they have a parent who has an underlying health condition that they could take it home to their family. Maybe one of them is a healthcare worker who if they're sick, they're making lots of people vulnerable. We need to think about the actions that we take and who we interact with and how we interact them, and how if we take COVID complacently, how it spreads to others. So again, for young people especially, think more about others and the potential impacts of your actions in the broad community and how you're potentially putting lots of other people at risk. We need you to step up and, as I said, to be a COVID guard like we're asking everybody to do. We need you to start reducing the amount of times that each week that you go out to socialize. We need you to keep your social circle small. It's especially important as you're getting together that you do it in small numbers, no more than 10. You're way more expertise at using technology than certainly I am. My kids tell me that all the time. There's lots of ways that you can get together virtually. We ask you to use those. If you're feeling unwell, even though it may be mildly unwell, stay home. And as I said, we recognize that for some people there are financial and other challenges, and we're working at solutions around that. Especially in the social environment, we know that using alcohol and other substances reduces inhibitions and makes it less likely that you're going to follow the public health measures. So please keep that in mind when you're going out socializing and understanding the impact of substance use upon the ability to keep each other safe. Wear your mask as a signal to everybody else that you are recognizing the need for you to take actions and that you're using that as a signal as a COVID guard, and we ask you to wear it proudly to do that. If you do all these things together, by taking a lead for all of the rest of us, we'll be protecting each other, and it will help us to get back to having life more normally much sooner than if we let it go and then we have to have a much longer, much more difficult journey with COVID-19. So this is a fight that we're all in together. We have 960,000 Nova Scotians. There's a special need for young people to be at the vanguard and be the leaders for all the rest of us. And by doing that, I firmly believe that we can put ourselves on that roller coaster that is a fairly gentle ride in the weeks ahead. Premier.
Thank you, Dr. Strang. Chrissy, over to you.
Reminder that we'll take one question and one follow-up in the amount of time that we have for today. First question will go to Mike Gorman with CBC.
Premier, we've heard Dr. Strang refer a couple of times to things that may be in the works when it comes to challenges people face vis-a-vis making the decision between going to work and staying home. And the reality is there are a lot of people in this province who don't make much money. They're not a member of a union. They don't get paid sick days. And we're asking them to stay home at their financial expense and in some cases peril. What is your government looking at? What can your government do so that people can abide by what Dr. Strang is asking them to do while not worrying about not having enough money for groceries or the rent or the power bill?
So we signed on with the national government. Everyone has 10 sick days, which would be the 2-week, 14-day cycle when you add the weekends in. That would be, and it's being administered through the national government, but that is, every Nova Scotian would be eligible for that.
Go ahead with your follow-up, Mike.
Dr. Strang, not long ago, you made the policy change that when someone comes back from outside the Atlantic bubble, if they can't self-isolate on their own, everybody in their house has to do it. As I understand, at the moment, that only applies to travel from outside the Atlantic bubble. Does it make sense if we're telling people to stay home right now, if we use the school connections as an example, for the other people in their houses to not also have to self-isolate? And given that we're looking at community spread, what are you doing to look at asymptomatic testing options?
So the first one, when we have a case in a household, almost by definition, everybody in that same household is now a close contact, and they have to self-isolate. So that, unless there's somebody living in a separate part of the house, whatever, but generally, if there's a case in the house, the whole household is automatically isolated because they're contacts, and we test them. We're looking at asymptomatic testing. We're, as I said last week, we're looking at a number with the new point-of-care tests. We're using it in fairly targeted ways. We're certainly working at how we use that in things like our exempted workers, like truck drivers, rotational workers. We're working to finalize plans in those areas. Certainly, as we have clusters and outbreaks, and we're looking at how potentially we've already started some of the bars. Everybody's used the word and heard the name Bitter End, so I can name the bar. All of the workers that we've worked with that bar and all the workers in that bar have been tested. So we're looking at things about how we may use testing, asymptomatic testing, to get a better understanding of where we might have unknown COVID activity in the kind of social networks that are involved in these, where we are currently with the clusters. So there's some logistic pieces we need to work out on how we might actually do that, but we're actively looking at that as well.
Next question will go to Andrew Rankin with the Chronicle Herald.
You did speak today about rumors around cases in schools that may not be true, but I'm just wondering, can you tell me about the situation here? How many suspected cases do you think there are in schools, and should parents be concerned that there will be more cases announced coming tomorrow, the next day, in the future? So
we have 2 cases in 2 schools. In each of those schools would be the number of people in their classrooms or buses that are now that are called close contacts, and they've all been isolated, and where testing has been arranged. I'm not going to speculate how many people out there that could have COVID. This is why we focus on people. If you're feeling unwell, stay home and do the self-assessment and get tested if appropriate. We fully expect we might get more COVID cases occurring. That's why I come back to, I don't want to focus on the schools. I want to focus on keeping our community safe. Because if we minimize the amount of COVID that is in our communities, we're going to minimize the ability for COVID to get into schools.
Go with your follow-up, Andrew.
So how many contact tracers does public health employ for the situation? And also, I'm wondering what percentage of the people that are determined to be contacts are quarantined within 2 days? Can you speak to that?
So I don't have the exact number of public health. We're actively working on recruiting more. We've got, our target is to recruit 100 we have through the federal restart money, and we're public health and the health authority is actively working to add to our complement of contact tracers in a number of different ways every day. Sorry, can you repeat your second question?
For those people who are identified as contacts, what percentage of them are quarantining within 2 days?
So as soon as we identify a contact, we work with them and arrange them to start to begin a 14-day quarantine period as quickly as possible. We don't have a cutoff. We don't wait. We do it as quickly as we're able to.
On average, though, how long does it take to get these?
I don't have that number.
Okay.
Reminder, there's one question and one follow-up for the reporters in the room and on the phone. Next question goes to CTV's Natasha Pace.
I just wanted to be clear on the two clusters you mentioned today. Are we still talking about the Clayton Park cluster, or is there a cluster now associated with Bitter End and then the school? Can you just clarify that for me?
So we have what we call the Clayton Park cluster that that was associated with a workplace, but was also associated with the Bitter End in downtown, and we had some other cases in another workplace also associated through social activity. So that's what I'm saying, we need to move our focus away from individual clusters and say we have this network of people that are linked through where they live, where they work, where they socialize. They're all interacting with each other, all in this 18 to 35-year-old age group. Certainly we know that the cases that are in the two schools are linked back to these other clusters through adults who are in a workplace. So it shows how that's a good example of how when you have the more spread you have in communities through workplaces, through social interactions, the more likely you're going to have school-age children exposed and therefore being in school. I have to make the point that these kids were not inappropriately in school. They were in school before at a time period when we judged that they could have been in there 48 hours prior to developing symptom phase, before anybody in this group was even known to be a case.
Natasha, go ahead with your follow-up.
Okay. You talked a lot about reducing our contacts and how we've kind of become complacent and we're out gathering more and having higher limits. Are you looking at ramping up enforcement at all for people who are gathering in groups of more than 10 or aren't wearing masks, aren't following public health directives?
That's certainly an ongoing conversation. We've already asked our enforcement folks, alcohol and gaming, our restaurant inspectors, food safety, occupational health and safety. They're actively working on developing an enhanced enforcement plan for the coming weeks. They've already been in the we've asked for increased enforcement in the downtown bar environment to support us over the last couple of weeks. We've also I have ongoing discussions through the chiefs of police around their role around ultimately whether it's private parties, other ways people are gathering, people aren't following the rules. Ultimately, it's the local police that need to be involved as well. And we have ongoing discussions, and I will continue to have discussions with them about ensuring that they are taking their appropriate role in kind of community compliance, if you will.
I'm told there's a lot of feedback on the phone line. Please, a reminder to keep your phones on mute. Next question will go to Kathleen Jones with All Nova Scotia.
Hi, Dr. Strang. Given the recent list of exposures in social places like bars and restaurants, are there any plans at the moment to lower the gathering limits in public places or to return to household bubbles?
So that's part we're in discussion about that, and what do we actually do today? It's really appealing to people to step up their game, do the right thing. We're actively looking at where we might need to go in the days or weeks ahead if people aren't responding appropriately. We have to understand every restriction we impose or every time we tighten down has its own set of consequences around whether it's employment or another thing, so we need to do that thoughtfully, but we're certainly fully prepared to go there. And I would say that we're prepared to go there perhaps sooner than other jurisdictions have been, because we don't want to end up in that position where they are at.
Go ahead with your follow-up.
Yep. And now that the federal government has rolled out its own sick leave program, are you concerned that people will not be aware of this program or will be going to work in spite of it because they don't want to deal with it?
I can't really comment. I don't know what steps the federal government has taken to communicate that, but hopefully people are aware of that. I'll take that back and we can look at what are things that we could perhaps do to make sure that people are aware of that.
Next question will go to Elizabeth McSheffrey with Global.
My first question is for Dr. Strang. I wonder if you've given any more thought to a 3-layered mask, given what we're seeing?
So, when you asked the question last time, we've talked about this at our FPT level as well. I think it's gotten kind of focused not focus too much on how many layers in the mask, as opposed to, yes, a 3-layer mask is optimal, doesn't mean that a 2-layer mask isn't good, and that what we need to do is really focus more on making sure people wear the masks when they should be wearing the mask properly. And yes, if you can wear a 3-layered mask, that's the best. But people don't need to run out and I'd much rather have people wear another type of mask, or like a 2-layer mask, than not wear any mask at all. Certainly, as we move forward now in our procurement of masks, we're looking at moving forward that we would be looking to get 3-layered masks, but we're not going to replace all the large amount of 2-layered masks. It's an incremental benefit, and I think that's more of a detail that we need to not forget the bigger picture around mask wearing in general, and focusing on that, and proper mask wearing is what we really is the most important thing to focus on when it comes to masks.
Go ahead with your follow-up.
My next question is for the Premier. I know in the summer, you said often we need to learn to live with this thing, and back then the idea was that we might pop the Atlantic bubble. Obviously things have changed. It's a little scarier now in Nova Scotia. We've seen other jurisdictions in Canada go back and forth between restaurants open, restaurants closed, businesses open, businesses closed, depending on their case numbers. I wonder how your interpretation of living with COVID has changed over time, what it looks like now versus the summer, given what we've seen elsewhere?
I don't think it has changed at all. Quite frankly, what has changed is that we have more cases right now. It's in various parts of our communities, but it is imperative that all of us believe COVID is next door to us, even as we try to function inside of our own jobs in our community. We should be. It's why it's been so critical. Dr. Strang talking about the public health protocols. I've said this many times. The answer for us keeping this virus at bay is within our own hands. We just need to follow the public health protocol. We're certainly not opening up the Atlantic bubble. We obviously have activity within our community. But I can tell you that if community spread continues down the path, I won't think twice about shutting down the economy again. People need to understand this. And I say to all those out there whose livelihoods may not have been impacted the first time, your actions are impacting the livelihoods of many, many Nova Scotia families. So let me be clear. We will not hesitate, if required, to shut down this economy in sections. We know that virus predominantly right now is here in HRM. This may be the first step, but we all, no matter where we live, I live in Annapolis County, we all should recognize that this virus is next door and believe it is and act accordingly.
Next question will go to Keith Doucette with the Canadian Press.
It's for Dr. Strang. I'm just wondering, your counterpart in PEI today upped measures for rotational workers, and this is on a day when she reported no new cases of COVID-19. There were also other steps taken, and she likened it to preparing for a hurricane. When you know the track and you know the damage that it could cause, you take steps ahead of time. You don't wait. So I'm wondering why you're still waiting to do things. I asked you this question 2 weeks ago about rotational workers, why you haven't moved to strengthen protocols around that. What's going on with that?
So we're looking at how we actually, the logistics around how we get them in and get them tested, and what's the capacity we have in our primary assessment centers, the lab capacity, et cetera. You don't just turn these things around on a dime. So it's an issue that we got people, team of folks actively working on that issue, along with a whole range of other issues.
Go ahead with your follow-up, Keith.
Now, my follow-ups, based on the pathology that you've seen so far, are you optimistic that if people rein things in, that you can contain this community spread to basically the Halifax area? Based on what you know, what is the threat to other parts of the province? In other words, how quickly can this spread elsewhere?
Well, I think we have to understand that there is the potential now. We are seeing the virus and community spread in Metro Halifax. That means that there is the potential for people to traveling in and out to maybe take it with them. But that's why it all comes back to what are we doing within, as the Premier said, across the province. It's not just about what people in Metro Halifax are doing. What is everybody doing? We have to act like the virus could be in our community. And certainly, folks in Metro Halifax, well, what are we doing to minimize the chance for spreading it around? We're at the beginning of what really the potential for where we at the second wave, but we're at the very beginning. So our actions can make a substantive difference on, as I said earlier, what path we go down. But it's about all of us doing that and not just focusing in one geographic area or not.
Next question will go to Jennifer Henderson with the Halifax Examiner.
Good afternoon. My question's for Dr. Strang. The school center asked me to ask you. I'd like to know how many students and teachers at the two schools are self-isolating.
I don't have the full number of students. I know in the junior high there were 7 teachers that were identified as close contacts, and in the high school there were two teachers. I just don't have the full number of students in front of me.
Jennifer, go ahead with your follow-up.
I think it was in the range of 53 or 55. I don't have the breakdown between schools, but.
Okay. The second question I'm asking, because of the catchment area for these schools, I'm familiar with the schools, and I'd like to know if public health has connected the two students who tested positive with a potential exposure in the same geographic area, which was the East Preston Rec Center. Have you been able to connect the students to adults who, may have worked in that same geographic East Dartmouth area?
So there's not. When I was briefed on this last night, there's nothing to suggest that connection. There was 4 individuals who were potentially connected, exposed at a different, a casual basketball event in that rec center. That there's nothing that would suggest that the individuals involved in the school cases are in any way part of that event.
Next
So
question.
you've ruled that out? Sure.
That's my understanding from what I got from the medical officer of health last night. And as they've looked at, like anything, we'd identify cases and contacts and do a thorough interview to understand what their activities have been, where they might have been exposed, and who they might have exposed themselves.
Next question will go to Sean LaRoche with CBC.
Good afternoon, gentlemen. I just wondered, Dr. Strang, how close are we to reimposing restrictions, and what would be the first things that you would look at restricting again to try and stop the spread?
So I'm not going to speculate about how close we may be. We're actively looking at that, and it'll depend on what we see evolving over the next number of days. If you understand where the highest risk for transmission is around how people get together in social environments and social gatherings. I think that'll give you an indication of where we're focusing our attention, of where we may apply some enhanced restrictions as a first step if necessary.
Go ahead with your follow-up, Sean.
All right, and both you gentlemen have been using kind of the carrot approach rather than the stick approach as we've worked our way through this. But it's been 9 months of living with COVID. Is it time to really crack down on people who just don't seem to get it?
So I think that, as I answered to a previous question, compliance and enforcement has always been part of our approach, and it continues to be part of the tools that we consider using. But I firmly believe that the vast majority of people, if we create the right, the rules for them, the vast majority of people are going to comply when they understand what we're asking them to do and why we're asking them to do it. But we'll always have to have some kind of a compliance approach.
Next question will go to Global's Alicia Draus.
Thank you. I'm just wondering about the plans for schools. Now that we've actually seen a case of COVID in schools, and I know that you guys said close contacts are all self-isolating and anyone else is safe to go to school, but a number of parents have chosen to keep their kids home because they're concerned. Is it now time to maybe outline the plan, what it would take to go to either a blended model or close schools down? Because there just seems to be lots of confusion over, what happens.
So we have certainly there's a 3-level plan. Where we're at with schools today, going to the blended model where grades 9 and up would go home learning virtually, and those grades below would stay in school but dispersed out in smaller groups in the existing school infrastructure, so we can make sure that they're able to keep distance. That's all out there and public in the return to school plan, and then ultimately we can go to everybody virtually. When we would go in that direction, it depends, as I've said previously, depends very much on the context of the situation and the cases and how the exposure may have happened, who have been contacts, how many people are involved. There's a number of factors that you can't lay out ahead of time. We have a plan of how we might adjust the education model that we will use that as we respond to individual events. We are nowhere near that with these 2 schools. We've had 2 cases, or a case in 2 schools, a single case in 2 schools. The appropriate steps have been made to identify classroom contacts, bus contacts. We've got those people all at home isolating. I'm very comfortable with the approach we're taking, and the work that was done yesterday between local public health and the school and the Regional Center for Education was all based on an established protocols that we've been working at since the summertime.
When this started, leading into September, the minister and his department, working with public health, has put in place protocols, cleaning protocols, which have been working in all of our schools up to this point. We purchased electronic devices that could be used if we had to go to blended model learning. And in essence, that's what's happening with these kids that are asked to go home for 14 days to self-isolate. The department will be working with them virtually to be able to continue their education.
Go ahead with your follow-up, Alicia.
I guess I'm just wondering what you would say to the parents who right now are keeping their kids home, and many say they're going to keep their kids home at least for the week. So what message would you have out there? Because I'm hearing from students that there's only, 5 kids in their class today.
So I would say we understand. This virus has made us all nervous. There's no question about it. There's been a tremendous amount of anxiety throughout all aspects of our lives. It's a natural feeling. I want to reassure those parents that the minister and the deputy and the Department of Education have been working with public health to ensure that the learning environment is safe. It's why we implemented the mask measure when we did, ahead of almost every Canadian province, if not ahead of them all in July, was to get kids ready to go on the school bus so they'd be able to wear them when they're in close contact with each other, putting them in classrooms. We know by wearing that mask, it helps at the level of protection. It's why we continue to enhance cleaning in our schools. But there's no question, we understand why they're feeling that way. We ask them to continue to watch their children, continue to look at their school community, and recognize that the teachers that are in that school, that the department and public health are putting in place all the protocols to keep their children safe. And when we identify a case in a particular school, we will take swift action so that we will notify parents, isolate those close contacts as we continue to try to keep the education model moving along.
Next question will go to Mike Gorman with CBC.
I don't want to overstate this because Dr. Strang, as you say, we're only talking about 1 case each in 2 schools. But I wonder, Premier, does any of this give you and the folks within the education department pause about the approach that's been used specifically in high schools? Because unlike the lower grades, kids in high schools are moving around all day. They don't get to stay in one set classroom, which enhances the possibility of them having more close contacts and even more people, and by extension staff, having to stay home. Are you still satisfied with the approach you're using, or is it something you think needs to be revisited?
Well, the department and the minister are always monitoring that approach, working with our partners. Obviously, these 2 cases will cause a deeper analysis. But I think it's important to recognize that as we continue to create some level of normalcy in our education system, there have been changes. Obviously, the public health protocols that we've instituted, we're there to help keep kids safe and staff safe with the masking and the extra cleaning. We have reduced the amount of movement within our school system, depending on when they the amount of time you're in one particular class as opposed to the number of periods you would have in the run of a day. All of those steps have been taken, but of course we'll continue to watch that, continue to monitor that, and if there are other changes that are required as we continue along, we will do that.
As teachers specifically and other staff in schools might have to be staying home to self-isolate, and you're then looking to bring in substitutes for them. I know there's a huge sub-pool. The size of the pool isn't an issue. Do you have any concerns, though, Premier, that subs might not be so willing to volunteer to go into these schools? And Dr. Strang, what would you say to a sub who might be concerned about going into that school, about whether or not they ought to be concerned to go in there?
Well, I'll answer first. I mean, they're clearly we've taken appropriate actions, isolated close contacts. Them going in now to work in that school, there is no more risk in either of these schools than there is in any other school.
And bearing in mind, when we're asking a teacher to stay home to self-isolate, we're also asking those students that would have been in contact. So not only would our student population would have been reduced as well. So, but listen, this is an ongoing battle to continue to make sure that we're able to provide the education and environment that we know kids best learn in. And at the same time, making sure we protect their health. To go back to why we started in July, the issue of masking. It wasn't by accident that we started in July. It was in preparation for September. We were trying to prepare children and families to get ready for that. And that was in preparation to keeping our kids safe on buses and in classrooms. We looked at the way we changed the makeup of how we move about in our schools. Some of them are different. You're very right, based on the size and the makeup of the class configuration. But we're very comfortable, that we're providing a safe environment for our kids. And to the minister and the department, immediately upon finding out that there was a case, it became very clear we were looking for contacts and closing classrooms down and sending those kids that would have been in contact with them home for that 14-day self-isolation, even though we have a higher level of protocols in our schools than we do in some of our other environments. So, we'll be vigilant on watching this. Listen, keeps us up. There's no question about it.
Next question will go to Andrew Rankin with the Herald.
Unrelated question. Quebec is planning to ban the sale of new gas-powered cars in 2035. Is that something you support? Do you think is that something that you would adopt? But else, do you think that the province should be providing some funding to make these cars more affordable to the average person?
I'm going to tell you, as I've said, I'm focused on COVID. That is the number one issue facing Nova Scotians. It's the number one issue facing all of us. And that will be my sole focus, will be on COVID. Future public policy will be made by future governments.
Andrew, do you have any follow-up on COVID?
Yes. Can you just give me a more clear idea of where we're at, though? Like, there's a number of concerned parents out there that are saying that there are far more children or students that have tested positive for COVID. Can you speak to that? Is there any truth to this?
No. We have had no school-age children test positive other than in the last a few days, other than the two that we've been talking about today. I've heard several rumors of that. So-and-so child was in a tested positive. I went back to public health, and they're absolutely clear. When a test positive in the lab, it automatically is electronically reported into our panorama system. We have public health teams that work early in the morning till late in the evening, and so we'd be completely on top of this. And anything that was reported overnight, we would have been aware of first thing this morning. There are none of them in our system. So these are all unvalidated rumors.
Natasha?
I just wanted to see if are there any numbers for if we don't like slow the spread right now, now that we're in the second wave, where we could be next month? Like, do you guys have any numbers for that right now?
No, we've done some modeling, more looking at what could be the potential impacts of various trajectories and the number of hospitalizations, et cetera. That is modeling. It's helpful, but it is the numbers that occur in 2 weeks from now. Some of the exposures have already happened. That's why the next week or so is really important to say what trend are we on. But really moving forward, the actions we all collectively take are going to tell how many new cases we have.
And I just wanted to double check on rapid testing. I think last time I asked you about it, you said that there are some limitations with the rapid testing kits. Is there any new information on that?
Well, I know there was another test approved yesterday. I just have not had time to get up to speed on that. But I think in general, we know that all the rapid tests are less accurate, and they all have some, using them with large numbers presents logistical challenges. So I answered earlier to another question that we're focused on how do we use these tests in a number of targeted populations.
Next question will go to Kathleen Jones with All Nova Scotia.
I'm just wondering, people are starting to book holiday parties at restaurants and event facilities with people who may not be in their immediate social bubble, their coworkers. Should restaurants stop taking these bookings or cancel them?
No, we have gathering limits and requirements around how events can happen. They can go ahead and be doing this. However, I can give no guarantee that in the middle of December or the third week in December that that the gathering numbers won't be changed in some way. That's, that's the reality. But people can do things as long as they're following the requirements. That we can have safe social activities. What the necessary level of safety that has to be applied through the public health order, I can give no guarantees that it won't need to change over time.
Do you have a follow-up, Kathleen?
Just to follow up on that, is the socializing with people, 10 people in a consistent bubble, is that an official policy, would you say, that people need to be following for events like that, where that may not be possible?
Well, certainly in the public health order that people can be in no more than groups of 10. If they're and if they're getting close contact in terms of social events that they're not staying 6 feet apart, the maximum number is 10. What we're asking people to do, so that's a requirement. What we're asking people to do is to be careful about how many groups of 10 they are in. Try to keep those groups of 10 consistent as possible. So if you go to dinner with some people tonight, and then you want to go to dinner on Saturday night, ideally it would be the same group of people and no more than 10 in that group.
Next question will go to Elizabeth McSheffrey with Global.
Very quick one, Dr. Strang. I don't know that I've heard this yet. Are we officially in the second wave in Nova Scotia? Have we hit it?
We're at the beginning of the second wave, where we have the advantage of every other province or the provinces outside the Atlantic Canada are well advanced in their second wave, and so us and our Atlantic colleagues can sit and watch and say what did they do that worked and what we might want to do differently. But yeah, we're in this increased number that I talked about in September, October, November, that trajectory. Clearly, we're now in the beginning phases of the second wave. The ultimate trajectory, again, depends on us.
Just to follow up, you mentioned with the school plan and our three-phased approach, which is available on the government website with the different blended learning and different models, but you said the plan for knowing when we go into one of those and how we choose that is not something you would reveal in advance, and I wonder why?
No, not reveal. We have to take each situation that faces us. We have to take the context. The next group of cases in one or more cases in another school may look very different because of who's involved, how they might have been exposed, what activities went on in the school, and the number of people that could have been exposed. So the next school, we might take somewhat different action. So we don't have a plan that we turn to and go, okay, now we're going to do X, Y, and Z. We use our public health expertise to say, what's in front of us, what are the appropriate actions that we need to take. But we do have a protocol that we work very closely with education that guides us, but it's only a guide. Then we need to adapt that with every specific circumstance.
It's the epidemiology of those cases that will determine which part of that education plan which gets executed.
Right, it's not like, okay, we've checked 10 boxes, so now we go to Plan B.
Yeah.
Next question will go to Keith Doucette with the Canadian Press. Keith, are you still on the line? We'll go to John LaRoche with CBC. Next question will go to Jennifer Henderson with the Halifax Examiner. Jennifer, are you still on the line? Last question will go to Alicia Drouse with Global. And that's all we have for questions today.
Thank you, Chrissy. I want to take a moment to talk about the cases at our two schools. I'm hearing that some students of those schools are trying to attach names to those cases. If you are part of the naming and shaming game, then you are part of a bullying campaign. That is not who we are, and this is not a time to embarrass or humiliate individuals with COVID. It is a time to show kindness and give people with COVID the space to isolate and get better. And it's also a time for all of us to remind ourselves to follow the protocols. As Dr. Strang said in his opening remarks, since November 1st, we have reported 42 new cases, and we are only halfway through this month. It has entered 2 of our schools, and there's no question I'm worried about that, but it has also entered a number of our communities and businesses. And for some of those cases, we don't know how. Dr. Strang is worried about community spread, and we should all be. I'm getting reports that young people are living their lives as if COVID is not here, going out to restaurants and bars even when they are feeling sick, gathering in large groups and not distancing, treating COVID like it can't kill, and we know it can. Look at what has already happened here in our province. Look at how many lives we have lost. Look around the country if you're still not convinced. Canada is reporting 300,000 cases and 11,000 deaths. That is not okay. You might say that's in another province, it doesn't impact us. We all know, based on our own history, that it does. Everything we do impacts what COVID does. If we follow the protocols, including keeping our social circles small, we can reduce the spread of COVID. But if we ignore the protocols, COVID will find a way in, and it is difficult to get it out when it is here. And some people are not taking this virus seriously. If this behavior continues, we are going to be in a position to shutting our economy down again. I don't want to do that, but I am not going to watch COVID overtake a community. So if you think COVID isn't real, if you think COVID isn't a risk, think again.